Right now, inside the bone marrow of women who are considered clinically cured of early-stage breast cancer, the body's own stem cells might actually be acting as, well, accomplices.
Yeah, structural accomplices, really.
Exactly. Like they are actively hiding dormant cancer cells from chemotherapy and, even helping them resist targeted hormone treatments.
Hmm.
It's totally contrary to how we normally view our native healing mechanisms.
Right, it really is. And I mean, the dynamic here is far more sophisticated than just a rogue cell, managing to survive treatment. We're looking at a highly coordinated communication network.
Uh-huh.
The cancer is essentially dictating its own survival terms to the surrounding environment. It's turning the body's natural defense infrastructure into a shield.
Which brings us to the actual mission of today's deep dive. We are taking a pretty dense stack of medical research, along with some really interesting commercial skincare data, to answer a very specific question for you, our listener.
A very critical question.
Definitely. We want to know, what is the oncological safety profile of MSC exosomes, that's mesenchymal stem cell exosomes, in patients with a history of hormone receptor-positive breast cancer?
And it's such an essential topic for you to understand because right now, exosomes are, well, they're highly polarized.
Oh, totally.
Like in the wellness and cosmetic space, they're marketed as this miracle regenerative ingredient. But in oncology, particularly with HR-positive breast cancer, they show this really complex, potentially dangerous signaling capability.
Okay, let's unpack this. Before we get into the specific risks for a breast cancer survivor, we need to clear up a major point of confusion fueled by the cosmetic industry. So biologically, exosomes are these tiny lipid bilayer-bound particles, right? Like 40 to 160 nanometers.
Yeah, microscopic.
Right. And they're naturally released by cells.
Yeah.
But they aren't just cellular waste. I like to think of them as an encrypted biological postal service. They actively transfer bioactive cargo, like RNA, DNA, and proteins, between cells.
Exactly. And that cargo delivery physically changes the receiving cell. The danger, or the therapeutic potential, really lies entirely in the specific messages inside that payload.
Right.
Because when they fuse with a target cell, they directly alter how that cell behaves.
Which makes the whole skincare connection feel a bit jarring. Like looking at the literature from Plated Skin Science, they market these exosome serums heavily for skin regeneration and anti-aging.
Yeah, they do.
But looking closely, those cosmetic exosomes are platelet-derived, not stem cell-derived. They're meant strictly for topical use. And because they come from platelets, they lack a nucleus. They literally can't replicate.
Right, and that distinction is huge. Since they don't have a nucleus, they don't have the machinery to, transcribe new pathways or cause cancer. Plus, they just sit on the superficial layers of the skin. They have absolutely zero scientific link to causing cancer.
So if cosmetic exosomes are harmless because they lack a nucleus and just sit on the skin, what makes internal MSC exosomes such a potential wildcard for someone with a history of breast cancer?
This raises an important question because it's not about the exosome itself mutating or replicating like a cancer cell. It's about the messages they deliver. MSCS, mesenchymal stem cells, they operate systemically inside your body.
Inside the bone marrow, mostly.
Exactly. And they have full genetic machinery. So the wild card factor is how they react to the tumor microenvironment. They can send highly specific messages to existing hiding cancer cells.
And that hiding spot is key. I mean, the research highlights this really startling statistic. In 10% to 30% of women who are deemed cured of breast cancer, distant metastases can show up years, sometimes decades later.
Yeah, it's a sobering reality.
And a lot of that happens in the bone marrow. The studies talk about these disseminated breast cancer cells, referred to as BM2 cells in the models, heading to the bone marrow and entering the state of metastatic dormancy.
Right. What's fascinating here is how active this dormancy really is. The bone marrow is a nutrient-rich vault, and it's where MSCs live. When the cancer cells get there, they don't just passively go to sleep. They actually prime the surrounding bone marrow MSCs to release specific exosomes back to them.
Here's where it gets really interesting. It's kind of like the MSC exosomes are handing the cancer cells fake IDs and, putting them into a cellular witness protection program.
I love that analogy. It's exactly what's happening.
Because these MSC exosomes, they deliver specific microRNAs. The research points out miR23B, which suppresses a cell cycle protein called MRRCKS, along with miR222 and 223. And when the cancer cell absorbs this, it's basically forced into a deep cellular sleep, the G0, G1 phase.
Precisely. And structurally, that is incredibly dangerous.
Why is that?
Well, think about how standard chemotherapy works. Drugs like docetaxel or carboplatin, they target rapidly dividing cells. So if the cancer cell is locked in a deep sleep, it's not dividing.
Oh, wow. So the chemo
It just passes right by it.
Yeah.
The dormancy makes the cancer virtually invisible and highly resistant to those systemic therapies.
That is wild. But hiding from chemo is just one part of the danger here, right? Because for your specific profile, if you're a listener with a history of HR-positive breast cancer, we have to look at how these exosomes actively disarm hormone treatments.
Yeah, this is where it gets really problematic.
Because, 70 to 80% of breast cancers are hormone receptor positive. So the standard of care is endocrine therapy, like tamoxifen, or aromatase inhibitors like letrozole.
You're right. The goal is to starve the cells of estrogen.
But the major hurdle is acquired resistance to these drugs. And the research shows this resistance isn't just a random isolated mutation. It's actively transmitted.
If we connect this to the bigger picture, it completely changes how we view the tumor microenvironment. These cells are networking.
Yeah, they're sharing information.
Exactly. Exosomes actually mediate the transfer of drug resistance. The exosomes can transfer MER221 and 222, which specifically target and downregulate ER-alpha and P27.
Meaning they get rid of the estrogen receptors that tamoxifen is supposed to bind to.
Yes. It rewires the recipient cancer cells. So this resistance can spread from just a few resistant cells to sensitive ones, making tamoxifen totally ineffective. They're essentially sharing the cheat codes for surviving endocrine therapy.
So on behalf of our listener, I have to ask, does this essentially mean our own native MSC exosomes act as traitors, actively working against the hormone therapy we rely on to stay cancer-free?
Well, functionally, yes, they act as accomplices, but biologically, they're just doing what they evolved to do, which is stabilize and protect damaged tissue.
It's just that the cancer has hijacked that signal.
Exactly. The cancer sends distress signals, and the MSCs respond by trying to protect it.
Okay, so given all this, that they help cancer hide and resist hormone therapy, it seems like the safety profile of native MSC exosomes is entirely negative. But the research calls them a double-edged sword.
Right. Because that exact same delivery mechanism can be used against the cancer.
It's the ultimate Trojan horse.
Yes, precisely. Not all MSC exosomes promote tumors. Some actually deliver tumor suppressors.
Like MIR16 and MIR100, right? The data show those suppress VEGF, which reduces angiogenesis. So basically, stopping the tumor from building blood vessels to feed itself.
Exactly. And others from adipose MSCs, like MIR1236, can actually reduce resistance to cisplatin, which is a chemo drug.
Okay, but the really groundbreaking part of this research is the engineered exosomes.
Oh, absolutely. This is the frontier. Scientists are now engineering MSCs to deliver synthetic payloads. They're called antagomers.
Antagomers, that's ANTAGOMIR, so basically anti-microRNAs.
Right, specifically antagomer 222 and 223. When they administer these engineered exosomes systemically, they traffic straight to the bone marrow.
And what happens when they get to those dormant cancer cells?
They reverse the quiescence, they neutralize the dormancy signal.
Wait, really? They actively wake the cancer cells up?
Yes, which sounds counterintuitive, but by waking them up and forcing them to divide, they lose that cytostatic camouflage.
Oh, I see.
Once they're awake, a really low dose of chemotherapy, like carboplatin, can actually recognize them and destroy them. In the models, this increased host survival significantly.
So what does this all mean? Let's synthesize this for you, our listener. If you have a history of HR-positive breast cancer, your native endogenous MSC exosomes currently pose a notable oncological risk.
Yeah, a very real risk.
They orchestrate that metastatic dormancy in the bone marrow, and they facilitate resistance to endocrine therapies like tamoxifen. But on the flip side, exogenous engineered MSC exosomes represent this highly promising, though still experimental future therapy to eradicate those hidden cells completely.
Exactly. And just to reiterate, because it's so important, this has absolutely nothing to do with topical platelet-derived cosmetic exosomes.
Right.
Those are completely separate entities. They don't have a nucleus, they don't penetrate systemically, and there are no linked cancer risks there.
Yeah, totally different ballpark. Which leaves us with a final kind of provocative concept to mull over. We've spent this whole deep dive talking about how our body's own stem cells are naturally inclined to protect and shelter these malignant cells by putting them to sleep.
Yeah.
It really makes you wonder, are we fundamentally misunderstanding the biological definition of healing? Like, does the human body sometimes prioritize immediate survival and, cellular peace over the violent process of eradicating the disease entirely.
It's a profound thought. Biology might just favor a quiet stalemate over a destructive victory.
Really makes you reevaluate everything we know about survivorship.
Yeah.